Hi, okay, so today we're going to do a sterile wound change dressing. I went and checked the medical chart. Patient is due for one. I came in 30 minutes ago, administered an analgesic after checking patient's ID. I checked the patient, come back in after gathering supplies, check the patient's ID again, of course, name, date of birth, and then I raised the bed to a comfortable working level, inform the patient of the procedure. We're gonna do a sterile dressing change. Has a pain med kicked in? Alright. So this particular dressing is on the patient's leg. I did perform hand hygiene, wash my hands. And I'll be putting on some regular gloves to start with. And then I will remove the patient's current dressing. I'm going to use the push-pull method. Go along so as not to tear the patient's skin, damage any more. Okay, when I pull it off, I'm going to check for amount, color, odor, type of. It's usually going to be preferably, hopefully as Sarah's saying was, hopefully it's not putulant, but you're going to know odor if there is any. Alright, and you're going to toss that out into the garbage can, your biohazard bag, and then of course you actually have to start measuring the wound. You can measure this way, length, it's 10.5 centimeters, width is 2 centimeters, and it's just a bit of a lesion, so it's not really deep. I would have to pull my Q-tips out to measure depth. So for now, I'm going to leave that the way it is, and I'm going to start to set up my sterile field. So we start with, there's the end of it. We always have to check expiration dates. You should check that when you're gathering your stuff. Off today. Touch the table or yourself with the sterile field. Okay, and to open it, you have 1 inch on the borders that is not sterile. And you can travel along that inch so as not to have to fan the actual paper. You do not want to fan it. Anything hanging off your table is also not sterile. Okay, so you open your bars. You're going to open everything away from you because you don't want it to touch you. Okay, and you can put that off to the side because if you need to, that's where your sterile water is going to go. Okay, then we have our Q-tips. Open those away from us as well. I'm going to try to put those a little bit to the edge in case we need to use one to measure depth. Alright, we'll open our lubricant. I'm going to have to put a little bit of moisturizer on the wound so that we keep it moist, but there's no maturation in there. Alright, and we have our dressing. Okay, so next, to actually clean the wound, I'm going to put on regular gloves again. I'm going to grab some sterile water. Oh. Okay. Pour some in a little tray. Alright, when you grab the sterile water, remember to grab it by the label. And then we're going to go from here to dip it in the water. We're going to go from the inside of the wound out. We don't want to hit the skin first or you can contaminate the wound. And you're going to clean it out. Each wipe will require a different gauze. Once that's cleaned out, now we need to move on to our sterile gloves. So we're going to open these. Cuff and one's facing you is labeled. So at this point you can touch this side of the paper and you open the center, and now you can only touch the very edge here. And mine won't want to stay open. Alright, I am right-handed, so I'm going to grab the right hand cuff and try to slide my hand in. Only holding the actual cuff and not touching the glove itself. My hands apparently don't want to go in today. For this one, we're going to cup the edge and we're going to put it on. We don't want to actually touch the cuff itself on the inside. Again, that's not sterile. And pull them down. At this point, we take the Q-tips, dip them in the jelly, put the jelly on. From there, we're going to put a piece of gauze on and another piece. Oh. Okay, and then we're going to go with our dressing, blue line out. Alright. At this point, we're going to grab some tape. Now that we have the dressing across it, we're not as worried about the sterile field. The sterility is to be under that. However, most of the time you probably could and may like to cut your tape first. Alright, you're going to tape all four sides. Okay, and then you're also going to add once you get all four sides then we're going to add another piece of tape across the actual bandage. This is going to have your name, the date, and the time, or your initials actually. That way they know just by looking at it when the last time it was done and when it needs to be done again. After this, you're going to cover up your patient, make sure that they're comfortable, turn the bed down to its normal position. You are going to want to get rid of all this fun stuff as well. It'll go in a biohazard bag. Those are usually red, because of course it is bodily fluids. So you can put your gauze in here in order to soak up whatever fluids left. I used a bit much. Alrighty. Throw everything in the garbage. Nobody likes a mess. Okay, make sure your patient is comfortable, that they have their call light, and go document what you just did. That you changed it, what you observed as far as your texture, amount, color, and odor, and size of the wound. You also might want to document too if it's like how the healing phase that it's in, if it's granulated or anything like that. Alrighty, and that is your sterile wound change.